It is estimated that up to 84% of adults in the United States suffer from low back pain at some time in their lives. This could be because of a certain muscle ligament strain, heavy lifting, hard labor, bulging or ruptured discs, osteosporosis, unresolved trauma to the spinal cord, or even sitting or lying for long periods of time. But what about in the hospital setting? What about in the hospice care setting? If a patient is laying down for too long, not only do they run risks of developing pressure ulcers, developing blood clots, and developing weakened lower extremities, but they also run the risk of developing back pain due to the long and constant pressure on the lower back. This creates a discomfort that can be eased with spinal cord stimulation devices. These devices send a low level of electricity directly into the spinal cord to relieve the pain through detachable patches that stick right onto the patient's skin. These devices can also wirelessly transmit and document any information into the electronic health record. If a patient needs pain management with the spinal cord stimulation device, the device will record how long the patient used it, where the patient used it, and the level of electricity that was used in order to determine the patient's pain level during and after the therapy. This form of documentation could essentially aid healthcare professionals in keeping accurate documentation in terms of pain management for patients. Hospitals care for an abundance of patients and always strive to improve care for them, nurture them back to health, and make sure that they are ready for discharge. These devices would aid hospitals in doing just that. Other than keeping a patient comfortable, these devices could also help patients in the hospital settings to sleep better, reduce the need for medications, improve the quality of life, and overall improve a patient's stay at the hospital. After they leave the hospital, they will have had low back pain management that prevented further damage and lifelong pain. As for hospice care, these devices would lessen some of the pain that a bedridden patient might be having as their life comes to an end. Improving the patient's stay is one of the domains for IHI Triple Aim framework, of which describes an approach to optimizing health system performance. These three dimensions that are included in this framework are improving the patient experience of care, improving the health of populations, and reducing the per capita cost of healthcare. Spinal cord stimulating devices aim at improving the patient's experience of care. With the 21st century's technological advances, spinal cord stimulation devices are the future of pain management. The goal is to get these devices into all hospitals and hospice care facilities and make them available to any patient that is having low back pain. All patients are deserving of a pain-free life, and spinal cord stimulation devices are exactly what hospitals and hospice care facilities need to make that happen.
Created using Powtoon.